Hey guys, it's Michelle here, the founder and CEO of ihelpmoms.com, where we are on a mission to make motherhood easier, healthier, and happier. I love talking with Dr. Kat Vigo. She is one of my favorite all-time experts. So thank you for being on with me today, Kat.
Of course, of course. Thank you so much for having me, Michelle. All of me.
Well, I love it. Yes. As a gym owner and a fit mom and married to a CrossFit competitor, I am very, very curious always about how to optimize the human body. And
Yeah.
what we do as moms during pregnancy is miraculous. It's incredible. And one of the biggest things that I've noticed is women don't know when to notice that they've had separation in their abdominal wall. They don't know the best ab exercises to do. And I think sometimes there's a lot of undiagnosis that goes on in the healing of that. So that is why we're bringing
Absolutely.
Dr. Kat on today to answer questions I have. So I'm bringing you on with me. So Dr. Kat, I want to kick it off today by asking you, what happens to that abdominal wall during pregnancy?
Yes, great question. So we all know that during pregnancy, especially if you carry a baby to term, to full 40 weeks, that abdominal wall stretches quite a bit. So we all understand that the muscles in the soft tissue elongate. The other part that we may or may not be aware of is that your rib cage also expands tremendously, and it actually tips this way. So we tend to tip back when we're
Yeah.
pregnant, right? Like if you see a mom who's leaning backwards and then her hips are a little bit thrust forward, that's where you could put a pregnant belly. Shook, right
Yep.
here.
Yep.
Okay. So the bony changes are huge. Also, our pelvic bones, they spread. We actually grow some more bone tissue there, and then they actually widen.
Yeah.
Okay. So it's the abdominal wall changes, and then also the bones that hold the abdominal wall.
Yeah. Wow, that is incredible. So when we're talking about postpartum, right? The
Yes.
doctor clears you. Women are like, I'm really tired, or I'm ready to work out, or maybe what happened, right?
Yeah.
And so hopefully down the line, as we get that clearance from our healthcare professional, we move on to wanting to get our abs back, wanting to,
Yep.
shed some of that baby weight. And
Mhm.
tell me a little bit about some of the safe exercises after that healthcare professional clears you, and maybe some of the red flags that we should stay away from.
Yeah, great question. Great question. Okay, so you're cleared to do exercises and you want to start engaging your abs. You want to make sure that you can engage your deep core muscles. Okay, so this is something you might have heard before and you're like, I don't know, am I doing it? One of the ways you can know is if you put your fingers to the bony part of your hips and then just inside, let your fingers sink in there and then cough. And you should feel some muscles pop into your fingers. Okay, you almost have to engage your deep core to cough. So you can feel where they are. Then you want to know if you can engage them consciously. So not just with a cough, but with intention. Okay, so we do it with a breath because it tends to be easier and then we can recruit more muscles that way. So we take a deep breath in. And then as we exhale, you can
Yeah.
think of fogging a mirror. You can think of bringing your belly button up towards your spine. You want to make sure you're not just sucking in, right? You
Yeah.
want to engage. You can even think that someone's going to punch your abdomen. So you want to brace or engage your deep core. And the second part of your question was what
So
to say.
let's say that we were maybe 10 weeks out,
Yes.
12 weeks out, we're hitting the gym again or doing some videos at home.
Yep.
And, is plank a good one to start with? Are VFs, right? Like we maybe want to stay
Right.
away from VFs a little bit. So walk me through
Yeah.
maybe the first exercise that might be good and then a red flag exercise.
Gotcha. Okay, that's a great question. So the foundation is that if you can engage your deep core, and we typically do it laying face up, standing, sitting, and then in hands and knees to start. So
Yeah.
that, bam, that's day one, right? Just a few breaths, exhale, tighten.
Yeah.
Then you want to start to see if you can maintain your deep core engaged with really basic movements. So Michelle, we just posted one about sitting. You take a deep breath in, exhale, tighten. You're sitting in a chair. Just see if you can bring an arm up and down and keep that engaged.
Yeah.
Seems like nothing, but it really does make a difference and
It
you
does.
engage your core and you would progress to hands and knees. If you're laying face up, you can start with like some head lifts, some easy marches with your legs, keeping this engaged.
Cool.
What you want to stay away from is increasing pressure inside your abdomen. because we can't really manage that early postpartum. And then we have to train in order to be able to manage it afterwards. So what I would say is, you want to avoid anything where your ribs and your hips come closer together. So that is when you're laying on your back, you can lift your head and march all day long, but you don't want to right away bring your rib cage closer to your pelvis.
Yeah.
So your crunches, for sure, not V-ups. You don't want to be curling your hips inward. And then we also love extension. So a lot of moms think they're not supposed to elongate their abdominal wall. You do want to. You want to elongate it for flexibility and strength.
This is why at I Help Moms, we believe in going to experts like Dr. Kat, not asking your best friend. Make sure that you get to painless pregnancy. And we recommend calling Dr. Kat when you're pregnant so you can get a plan in place so that postpartum, you have awesome care. Because let me tell you again, as a gym owner, you want to make sure that you're taking care of your abdomen, you're taking care of your pelvis, and you're just really making sure to protect this miraculous body that we have so you can heal properly and get on the pathway to optimal health, optimal healing with an expert like Dr. Kat at Painless Pregnancy, which leads me to my third question. So a question that I often have, Dr. Kat, is I don't think that a lot of women know what diastasis is. And I would love for you to talk to us a little bit about your niche of helping mothers to heal and what is diastasis, and then what are the signs that maybe they should give you a call?
Great question. I love it. Yes, ma'am. So diastasis is when your six-pack muscles come apart. Straight up. It just means a separation of those muscles. Okay. The other components of it, oftentimes they can be close together, but the tissue in between that holds your six-pack muscles together is damaged, stretched, poor tone, those things. Okay. How that looks is a couple different things. It can be like a coning. So when you stand or when you lift your head, instead of having like a more flat look to it, it's like a triangle. It can also sink inwards. So instead of having, again, a flat plane of an abdominal wall, you see it go inwards. It can also be like a puffer fish. So you go to engage your core and it just becomes bigger. And you know, that's not right. Sometimes it can look like that. Sometimes it just feels wrong. You feel like you're not engaging your core. You feel like you're disconnected. It can cause back pain, pelvic floor pain, incontinence, pain with intercourse. All of those things can be correlated with a dysfunctional abdominal wall.
Yeah, it's so important. And let me get this right, Dr. Kat. My friends have all used you and they absolutely rave about you. You go to the mother's house, to the parents' house, and help them right in the comfort of their own home. Is that right?
Yes, we do. Yeah. So I tried it for over a decade in the clinic. They got better. They loved it, but it was just a hardship to get out of the home consistently on time. And you know, with your three beautiful girls, you're taking them day 2, week 2, month 2 to the doctor. Like that's exhausting, Michelle. That's exhausting. So to get the care for yourself, we're just like, nope, bottom of the barrel. We'll do it when we're 80. So yeah, we want to take out those barriers when we want to come to you and make sure that you get expert care exactly where you are.
This is why we love bringing you resources that make motherhood easier. We love you, Dr. Kat. I can't wait to see you. I guess we can. Thank you for being such an incredible supporter of I Help Moms. And we just rave about you. All of our moms rave about you. So thank you. Thank you. Thank you.
Thank you, my friend. I appreciate your time.
All right. I'll see you soon.
Yes, ma'am.
Bye.